strongly urge the provincial and federal governments to take urgent action on Sickpay. Please step up and make this guarantee for the duration of the pandemic. As the mayors and chairs have pointed out many times, failure to address this adequately is putting health at risk and will ultimately lengthen the time needed for other public health measures to be left in place. Investing more in pandemic sick pay now is an investment in protecting the health of all of our residents and one of the best investments that can be made in expediting the long-term economic recovery of the GTHA and thus the entire country. The mayors and chairs also discussed the matter of travel and how best to ensure that people coming and going to and from Canada doesn't make the COVID problem worse. It was agreed that stricter travel measures now would be appropriate. And it was agreed that the management of the virus, and likely the variant as well, calls for additional screening and monitoring measures. The federal government is urged by the mayors and chairs to adopt increased quarantine enforcement mechanisms, including technology, which do not rely on local officials who are already very hard-pressed. In addition to the recently instituted 3-day advanced testing requirement for travelers arriving in Canada, the mayors and chairs urged the federal government to consider additional testing measures at the airports to detect the presence of viral variants. I think it's important that the federal and provincial governments know these actions have the full support of the City of Toronto and the leadership of all of the large GTHA municipalities. It is my hope that they will take these actions soon in order to help us all protect the health of our residents and to save lives. You'll recall in the early days of the pandemic, we stressed many times that fighting COVID-19 would be a marathon and not a sprint. I know today, a year after the first case arrived in our city, it seems like this is an endless marathon. But we have made progress. A year ago, there was no vaccine. There was COVID, but there was no vaccine. Now, we will soon begin the task of distributing the second dose of a vaccine to residents in our long-term care homes and working to make sure that we're ready to administer COVID-19 vaccines to all residents. We are closer to the finish line of this marathon than the starting line, but we still have a long way to go. That is reason for all of us not to give up hope for a COVID-free future on this late January day, and this anniversary we'd probably rather not be marking. And on that note, I will ask Dr. Davila to present her report for today.
Thank you, Mayor Tory, and good afternoon. Today I'm reporting 767 new cases of COVID-19. 13 more people are in hospital, bringing the total to 508. Sadly, 15 more people have died. With regard to COVID-19 data, I want to let you know about a temporary change in our reporting that will be reflected next week. We will still provide the new cases over the previous day, as well as total cumulative cases, new hospitalizations since the previous day, ICU admissions and intubations, deaths since the previous day, and cumulative deaths. The reason for the temporary change is that Toronto Public Health is migrating to the provincial case and contact technology system. This will bring all public health units in the province into the same system. This is entirely technology systems related, and the project is expected to be completed next week. The project does not affect Toronto Public Health's day-to-day operations, so otherwise it is entirely business as usual. On another note, there is a lot of discussion today about COVID-19 variants and the risks they pose. The UK variant B117 is now confirmed as the strain of COVID-19 that spread through Barry's Roberta Place long-term care home. My understanding is that 129 people live there. 127 tested positive, as have almost 90 people who work there, about half the staff. 40 people have died. This is a terrible price paid and a stark warning for the rest of us. Toronto Public Health has today contacted all long-term care and retirement homes, as well as complex continuing care and rehabilitation hospitals, to get them to review, audit, and reinforce their current infection prevention and control measures for COVID-19. These measures include screening of residents, staff, and anyone who must enter these facilities, universal masking, supply and use of personal protective equipment, consistent thorough hand washing protocols and requirements, physical distancing measures, environmental cleaning, surveillance testing, and auditing. Other congregate and group settings are being similarly advised. Toronto Public Health's Communicable Disease Liaison Unit is engaged, along with our long-term care and retirement home liaisons and the infection prevention and control advisors and supports available through Toronto hospitals. In this environment, it is a relief that the first round of vaccinations have been delivered in Toronto at all 87 long-term care homes and all high-risk retirement homes. The fact is, infection prevention and control is truly everybody's job now, everywhere in Toronto. There is still a lot of work to do to conclusively understand the extent to which the known variants are more transmissible or if they cause more serious disease. We know the UK B117 variant is in Ontario. We must assume it will spread. With that in mind, the most important thing to do is to act in ways that protect yourself and everyone around you. COVID-19 is a dangerous virus in any form. We never know if infection will lead to mild illness or to worse. A survey out of the UK in November found that 1 in 5 people still had symptoms 5 weeks after their acute COVID infection had passed. 1 in 10 identified symptoms 12 weeks or more after their initial infection. This is a phase of the pandemic where the choices we make will have real impacts on the health of others, for better or worse. We can create barriers to variants spreading widely if we avoid situations where COVID-19 can spread. You have heard before what I am going to say next. I hope you will take it to heart more than at any other time. This means keeping apart as much as possible. It means making as few exceptions to contact as we can. So I want to return to actions I advised often last fall. Every time you have to make a decision that could put you into contact with other people or require you to leave home, ask yourself, is this something I have to do, or is this something I want to do? And if it's something I want to do, can I not do it? Can I defer it? Or can I do it online? And if none of those are possible, what is my plan to make the activity as low contact as I possibly can? You know I am sympathetic to the sacrifices and the strain of life in the COVID-19 pandemic. But for now, the time has passed for focusing on impositions, inconveniences, or frustrations. This current situation, in the simplest terms, is not good. For now, We need to focus on things as they are and do everything we can to make sure that things don't get worse. Many people today are noting an anniversary we'd like to forget. A year ago, we announced the first confirmed case of COVID-19 in Toronto. I wonder who imagined then what life would look like a year later. Almost 83,000 cases in Toronto. More than 5,200 people hospitalized. And 2,324 lives have been lost to COVID-19. I believe it is possible that in 2021 we can pick up with the best of where we left off. With schools back, with the freedom to move, with one another's company, and do it all in safety. But there's still a way to go, and it will demand a lot from everyone. But we have learned a lot, and we know what to do. I encourage you to imagine that a year from now, life can look so much better than it does right now, and to lean in hard in the effort to get us there sooner, healthier, and together.
As both Mayor Tory and Dr. De Villa have acknowledged, 1 year ago today, the first case of COVID-19 was confirmed in our city. This unprecedented emergency has taken a devastating toll on many, including the more than 2,300 residents who have lost their lives as a result of COVID-19. I offer my sincere condolences to those who have been impacted so heavily. Since before the arrival of the first case in Toronto, our teams have worked tirelessly to save lives, prevent the spread of COVID-19, and to do all that we can to protect our healthcare system. With those goals in mind, our coordinated enforcement teams continue to work diligently to enforce the regulations in response to COVID-19. The city has taken formal enforcement action 2,066 times to date. This weekend, our enforcement officers continued to monitor compliance with the Reopening Ontario Act. As a result of violations of the Reopening Ontario Act, 6 charges were laid and 8 notices were issued against owners and operators of retail stores, personal service settings, and grocery stores. Our officers also inspected 90 bars and restaurants, resulting in a 98% compliance rate. 2 charges were laid as a result of violations of the Act. I want to thank the vast majority of residents and businesses who continue to help stop the spread of COVID-19 in our city by complying with the public health restrictions and regulations. Over the course of the weekend, 40 charges were laid as a result of the investigation of complaints relating to large gatherings on private property and in private residences. This weekend, Toronto Police also responded to protests and rallies in both Nathan Phillips Square and Yonge Dundas Square and issued a total of 24 charges as a result. This includes 14 charges under the Emergency Management and Civil Protection Act and a further 10 charges under the Criminal Code. Unfortunately, we also continue to experience issues with the use of outdoor ice rinks after hours. Our Municipal Licensing and Standards team, working in collaboration with Parks, Forestry and Recreation and Toronto Police, continue to work together to support safe outdoor activities while protecting public safety. Attempting to access and/or use outdoor rinks outside normal operating hours is both dangerous and illegal. We also remind residents that when using parks to practice physical distancing, to wear a mask as much as possible, and of course, whenever physical distancing is not possible. We are continuing to work hard under the direction of our Medical Officer of Health to ensure that we are ready to roll out a citywide immunization program that effectively prioritizes our most vulnerable communities as very soon as vaccines are available for administration in our city. The administration of COVID-19 vaccine represents hope in the fight against the virus and moves us closer to the day when COVID-19 is behind us and where we can resume all of the things we miss so much.
A question for Dr. Davila. The province offered its latest vaccine rollout plan today, once again suggesting it will be later this year before it becomes available to a wider population. I'm just wondering your thoughts, based on the timeline for the vaccines at this point. How long do you think current restrictions and measures should be put in place, and when do you think they would be lifted as a result?
You know, Mark, I think that's $1 million question that we would all love to have an answer to, and I wish I had a simple one for you. Certainly, I can tell you that here at the city, we're working very hard at Toronto Public Health and with our city partners, Chief Pegg and the entire immunization task force, that when the supply does become available, that we here in the local level and on the ground are ready to put out vaccines as quickly as possible and to participate in those efforts to get vaccine into arms in the most timely fashion possible. When it comes to understanding when we might expect that restrictions would change and when life might look a little bit more like what we were used to prior to COVID-19, I think that's still very much a question. We understand that the vaccines do provide, so far, based on the studies that are available, good protection against COVID-19, but I think there are still many unanswered questions at this point in time. So even as we get vaccines out there and even as people increasingly become protected against COVID-19 through immunization, for now, the best advice is to continue with current practices, to continue with self-protection measures until such time as, one, we have enough of the population vaccinated, and two, our understanding on the impact that vaccine has on COVID spread and what we're seeing actually out in the community is better understood.
Based on that last point, do you think we'll be able to ease up on those measures once that the majority of people have those vaccines in their arms, or do we wait for so-called herd immunity to kick in?
Well, really what you want to have is a sufficient proportion of the population appropriately covered and protected against COVID-19. New vaccine, new virus, we don't have all the answers yet, but you can be sure that we are all watching as a global community of public health professionals to try to understand as much as possible. We know that there are many other nations who are, also in the midst of vaccinating their populations and undertaking studies as well. I would like to think that the kind of global scientific cooperation that characterized the rapid development of vaccines might also characterize the relationship amongst the scientists as we seek to understand the impact of vaccine, the spread of COVID-19 in the world after vaccine becomes more broadly distributed, so that we can start to make those decisions in as informed a fashion as possible.
Okay, thank you. We'll go next to Farah Morale from CBC News. Farah?
Hi there. My first question is for Dr. Davila. You talked about the spread of the UK variant here. There are obviously growing concerns about the spread in the GTA. I'm wondering, on a city level, though, are these new variants sort of changing general approaches the city is taking in fighting COVID-19? I heard you talk about TPH contacting and checking in on enforcement of rules at long-term care homes and other facilities, but is there anything else the city is changing to, its approach in fighting COVID-19? For example, stepping up contact tracing, stricter gathering measures, considering that the UK variant is believed to be more transmissible?
So far, you're asking excellent questions. So first and foremost, we know that the population that is most vulnerable to the negative impacts and to severe outcomes associated with a COVID-19 infection are those who are older, and particularly those within those congregate settings like long-term care homes. So certainly, as you've heard, we've put out advice, and we are specifically asking those types of congregate settings to really do a thorough review and audit of their current practices so that they can be sure that the best infection prevention and control measures are being practiced, that they're being practiced consistently across the board by their staff and all those who need to enter those facilities to provide that essential care to the residents of those settings and homes. So first and foremost, that's what we've done. As well, we're working in partnership with Public Health Ontario and colleagues all around the province. Our provincial counterparts have put out some early guidance around how better to do case and contact tracing so that we better understand what's happening around the variants of concern that are starting to emerge here in the province. So certainly there are heightened practices for case and contact management when there is reason to believe that you are dealing with a case that is due to a COVID-19 infection with a variant of concern. So those are some of the early steps. Again, new variant, still new processes, and I expect that those changes may continue to develop over time as our knowledge on these variants continues to develop.
Thank you. My second question is for Tori. You'd mentioned this call by the GTHA mayors and chairs today to step it up when it comes to sick pay. You talked about the fact that people are still coming to work sick. You know, we've already heard from the federal government that they're not upgrading the Canada Recovery Sickness Benefit Program. Premier Ford has said he's not going to add anything on top of that. How realistic is it at this stage that either of these governments will heed your calls, and they've both made it clear that nothing is really changing?
Well, there's always hope. You know, when you have the mayors and chairs representing millions upon millions of people and they agree as one that this is something that is contributing, and it's shared by the medical officers that advise us that this is contributing to the spread of this virus. I don't know how they couldn't find their way clear, the two governments, to find some resolution to this that improves upon the status quo. What you have at the moment is a benefit, and I give the federal government marks for having one, but the evidence we have from people we've spoken with and people we've been trying to encourage to get tested is that it doesn't meet even close to their current wages. It takes too long to apply for it, and it takes too long to receive it. And the net of all of that is that people just decide they're better off going to work sick. How could it be that we have a situation where people conclude they're better off going to work sick and then almost inevitably spreading, as we've seen from the workplace outbreaks, the virus to other people? And so you live in hope that people are going to do the right thing. And I know certainly from my discussions with the federal ministers in particular that this is something they are constantly looking at and constantly reviewing. I will say I had a conversation earlier this week with Jagmeet Singh, the leader of the NDP, and our parliamentary system works on the basis that people in the opposition get up and ask questions on this kind of thing, and I trust that might have happened today. I'm not sure, but maybe as time goes on and we see that it is having a negative effect on people's lives and on their families and on a whole bunch of other things, some of these changes that I think could be made without too much difficulty will in fact be made. I'm optimistic about that. Just got to keep at it.
Okay, thank you. We'll go next to Shauna Hunt from City News. Shauna, go ahead, please.
Hi there, good afternoon. My question is regarding enforcement. Is there a Toronto Police representative on the line?
Yes, there is. Inspector Matt Moyer is on the line from Toronto Police Service.
All right, okay. I'll start with Inspector Moyer then.
Okay.
It's regarding an incident weekend at Yonge Dundas Square. A City News camera operator was gathering footage ahead of an anti-mask protest. The square was essentially empty aside from police officers. Our camera person or operator was alone. He had a mask on, and he was confronted by an officer who told him that media is non-essential and he had no right to be in the square, and if he didn't leave that he would be ticketed. So first of all, I would like your reaction to that incident, and secondly, I thought people had the right to be outside and that officers were not allowed to stop people unless they were obviously breaking the social distancing rules. So I guess my question is, if this can happen with the camera rolling, how can the public have confidence it won't happen again?
Okay, thank you. So, Inspector Moyer, you'll need to do star 66 to unmute yourself. Go ahead, please, sir.
Yep. Can you hear me okay?
Yes, sir. Go ahead. Thank you.
Thank you, Shauna, for your question. So I'll take the first question regarding the role of the media, and I can tell you that as soon as this was brought to our attention, we did ensure that the officers on scene were provided with the proper information, and it's our information that there was no other issues after that. I think the necessary apologies were made, and any intervention or interaction that was made with the best intentions. Again, simply because we are dealing with a large crowd, a large gathering, and social media. So, like I said, that was resolved and rectified as soon as possible. The second issue, I guess you were asking about with respect to people's right and what is their right when they're outside in terms of their ability to peacefully protest. And we recognize, yes, you're absolutely right. People have the right to peacefully protest, but at the same time, this is a public safety issue. And if somebody is, when we have large gatherings, like we do on the weekend, then the challenge for us is to not only look at from a public safety standpoint, from a public health as well. We have a piece of legislation that we're working with right now that specifically speaks to that in terms of the Emergency Management Civil Protections Act and the stay-at-home issue and the stay-at-home order. And this is what we were using as a guide in terms of our enforcement, our education, and the direction that we were giving people on Saturday. Not an easy task, absolutely, and filled with a lot of challenges when you have a moving mechanism like a large crowd in the young Dundas Square. But nevertheless, I think the situation was resolved adequately.
Yeah, and I just want to quickly follow up on that. I understand the protest and the large gatherings of people, and I understand, I guess, the enforcement that comes under the stay-at-home order with that. Our cameraman, this was before the protest, so he was alone in the square. So I just, for people who are in Dundas Square or out for a walk, how can they have confidence that they won't be stopped, just walking outside by a police officer?
Well, we don't make it a habit of randomly checking people, and we have not since it's begun. That's not the point of it, and it's not our intent. What we were dealing with on Saturday was a large gathering, and if you look very clearly, it indicates and specifies for us our role with respect to large gatherings. We've been issuing the cautions. We've had those conversations. This has gone on for weeks, and now we are in a position where we are using enforcement and we're issuing tickets. We did run into some challenges with people, but all in all, I think that the messaging that went across, whether it be a conversation or a ticket, sent a very clear message to those that were involved that when you're going to come out and compromise the health and safety of everybody in the city, particularly during a pandemic, you will be walking away with a ticket in your hand at the very least.
Thank you, Inspector. We'll go next to Denise Paglinawan from the Canadian Press. Denise?
Hi, thank you. My question is for Dr. Davila. I'm wondering if Toronto Public Health is considering testing long-term care homes for any variants.
So thanks for the question. As you know, testing is one of those things that's actually done as part of the healthcare system and is done with clinicians. So certainly at Toronto Public Health, we provide advice on circumstances, particularly in the investigation of outbreaks where testing is warranted. But what is happening right now is that our provincial counterparts, and this we've learned through discussion with them as we are in regular communications with them, there is a provincial plan around trying to understand to what extent are variants present in the province. So they do have a methodology that they have shared with the province and with healthcare providers who are doing testing and those who are doing follow-up. There is a targeted screening process. So people who are identified as, say, for example, having traveled or having been in contact with someone with recent international travel. There are a few other categories of individuals. Those people who are going for COVID testing are being recommended for further screening for variants, and as well they're doing some studies on the samples that they do receive at the provincial lab, and this is under provincial purview, to determine to what extent we are seeing variants amongst those samples.